Hello everyone, welcome to our podcast. Today we are joined by someone who has dedicated years of hard work, discipline, and compassion to the noble field of medicine. A future doctor who is not only learning how to treat illness but also how to bring hope, healing, and comfort to people in their most challenging times. It is my pleasure to welcome a passionate future doctor, Dr. Sarthak Vashishtha. Hello, Sarthak.
Thank you so much. Hey, Gauri. Thank you so much for the wonderful introduction of mine.
Okay, so how are you feeling right now?
I'm good. I'm good. What about you?
Nice, nice. Okay, so let's start, right?
Yeah.
Okay, what inspired you to pursue medicine?
See, what inspired me to pursue medicine was not, a straight line that I thought I'll be treating the community, or I was very, inspired by the diseases. It was not at all like that. First of all, I was already interested in biology and I was already interested in human sciences. Nextly, I was very weak in maths, to be very honest. But when I did my 11th and 12th, by the time I realized that our nation indeed needs some good medical professionals, so that some diseases are advancing, the treatment are likewise also advancing. Just not to transfer our jobs to AI, we just need some passionate youths to be in this line. So I just dedicated myself first.
Nice. What an amazing answer. Lovely answer, right?
Yeah.
Like indeed truth.
Yes.
Okay, so what has been the most challenging part of your MBBS journey right now?
The whole MBBS journey was challenging, first of all. And the most challenging part of my MBBS journey was getting out of my comfort zone to study. When we are doing our schoolings, we are not in habit to study that much. Our table time is so less. We are fed up. We are completely mentally exhausted just in the table time of 3 to 4 hours. But in MBBS, in first year only, we have that much syllabus. Even our compiled syllabus of schooling in 9th, 10th, 11th, 12th can't compensate for that. So the most challenging part was to increase my sitting time. Most challenging part was to remain dedicated for what I'm studying, because sometimes the mind is somewhere else, the body is just present on the table, and we're just going through and reading, mindlessly. So that is a complete waste of time. So this was, I think, for me, it was most challenging part, just to remain concentrated, just to change my schedule and dedicate the major time of my day, I think around 17 to 18 hours in the books only. And yes, when I talk about books, it's books. It's pure text reading, nothing else. Because, internet and AI, we can't Google the diagnosis, we can't do anything related to the technology. The more we read book, the more we go through the text, the recent advancement in the technology, the more we gain knowledge about it. So yes, this was my tough part.
Truly, this was so much challenging that you have to just sit one place and just read books. Read,
Yeah.
and remember also, only reading is not the
Yeah,
option, right?
not only reading, we have to, absorb each and everything, every line we are reading, everything, and we have to imagine. While certain subjects of the surgery which needs certain subjects of the MBBS, like surgery and anatomy, which needs imagination, so we have to be conceptual in each and every line we read. So that was tough.
Yes, definitely. It's
Yeah.
literally required a lot of hard work and dedication also to just sit.
Yeah.
Okay. So, is there a moment during your studies that made you feel, yes, I choose the right profession?
I can hardly think of any moment that make me feel yes, I choose the right profession, but I can count upon numerous which made me feel no, I am at the wrong place. So yeah, there were certain moments which made me feel that I choose the right professions, especially when I see people in the ICU, when I see people, in my language, I call them needy people, not money wise, not financially, but they need a support. And, they need, when the person is in ICU, when the person is in certain, vegetative state or certain critical stage, he needs one person whom he can rely for. His attendants also need one person whom he can rely for. And that person is doctor. the only thing which he can search for, which he can rely upon, is a doctor. So when, when I interact with a patient during the ward rounds and history taking, or during the, vital assessments, etc., even they know that I am not a consultant, I have not reached a certain level, but now then also, they are very eager to know about themselves, whether I would be cured. So that level of trust, and that level of dependence, when you see the patient is very trustful, or a stranger which you have never came across to your life is trusting you at that level, that he's giving his life in your hands with full trust and dedication, that yes, he is the right person, he'll be saving me. So that is, a very good and motivational moment for all of us, and that keeps us pushing through, studying and studying. That was one of it.
Truly said that people just trust on doctors that we are here and we will be cured. So this is
Yeah.
the, yes, this is the thing that firstly people require to make that trust. Now it is not easy to trust anyone, to give their lives in anyone's hand.
Yes,
Definitely.
exactly.
Nice. So what does a typical day in the life of an MBBS student look like?
Okay, that's something interesting. Okay, I'll be telling you the concise schedule of a average MBBS student. Imagine just being me. So our day usually don't start. We don't sleep. So our day is around circle. So if I tell you 7 o'clock we have to wake up. If we are engaged in some extracurricular activity like I usually go to gym. So 7 o'clock to 8 or 9 we are at the gym. 9 o'clock the lecture starts. Once the lecture starts, it's remains started. It doesn't end. It is on and on and on and on. We get time from 1 to 2 for our lunch, and after that we have before that we have clinical posting, so we have to go to hospital in the certain department which we are posted, contact teacher, ask them what we need to do today. If they are in mood of teaching something, they'll teach a new topic, or otherwise they'll send us to the ward just for the history taking and the vital taking of the patients. Or if the interest some new and interesting case there is in any department, they'll just ask us to go and handle it yourself. So after that, all the lectures with uh, our own subjects of MBBS, in third year we have forensic medicine and preventive and social medicine, along with the allied subjects like surgery, pediatrics, obs, gynae, some extra classes we have to take. And after that, 4 o'clock we are free, officially free from the college, from the classes. The day starts from 4 o'clock when we are left on our own to study. That is the study time. Basically, college study happens. We know how it happens. So from 4 to 5, just 1 hours of rest. From 5, some people usually take lectures from Marrow or any of the app subscription which they have taken, or some manual reading of the book like I do. I take lectures indeed, but I prefer textual readings because it is more impactful to my mind. I can remember memorize more when I read texts. So we read and we read and read till the dinner time is there. Dinner time is from 7 to 9. So 7 to 9 we're officially free. 7 to 9 it's not like okay we are going for dinner. We'll roam around in the campus, do some. I usually go to temple at that time, and I return to my room 9 o'clock. From 9 o'clock, because obviously we live far from home, so we call our homes and talk about our day and everything. So 10 o'clock is the time when I usually sit for study, and it continues on to morning 4 o'clock or 5 o'clock, until unless the dedicated topics which I have planned for the day are not covered. So major the difference from the schooling and the college study is that we don't have yet time limit. So in schooling, what we used to do is 4 to 5 is our study time. We'll study. The topic ended or not doesn't matter. 5 o'clock the books has to be closed, but that doesn't work out in the college and professional life. We have to plan out certain topics, that these are number of topics from that dedicated subject which we have to cover, until unless we are not allowed to sleep. Actually, it is not allowed to sleep. We can't sleep. I personally can't sleep when I see my day planning schedule is not going how it is supposed to be. I can't get my eyes closed and rely on my pillow. So it extends from 10 o'clock. ऐसा नहीं है बीच बीच में we take short breaks, whether it be coffee break, whether it be Instagram reel scrolling break, but not more than 15 minutes. It extends till 4 or 5 in the morning. and this is when we sleep till 7, 5 to 7 2 hours sleep is more than sufficient for us. Even 4 hour 4 hour sleep is a luxury for us during our university examinations, because the syllabus is so huge. It's like, doing a world tour in just 2 days. So this is how a typical day in my life looks like. And in between slots, the space for, bathing, cleaning, so it is inculcated in the daily schedule only.
You also have to just like attend clinical postings whole night, right?
Yeah, sometimes, when we are interns, so we are posted in the emergency department or in any department at the night times, because looking toward, and moreover, the pressure on a male MBBS student is more, because looking towards India's good condition towards the safety of the women, NMC has released a new rule that no female intern would be posted in the emergency department during night time. No matter the hospital is in vicinity of the local area or the hospital is isolated, because certain cases have been there in the future, in the past.
Password.
Tragedies to the women in the night wards, especially doctors. So the male interns have to be there in the night doing duties and all. And next day, never or less, we have to carry the regular schedule on. It's not like we are doing the night duty and next day we are sleeping whole day. No, the schedule would be badly, damaged, and it will mentally harass us later. So next day, waking up and continuing the same schedule is little bit, impactful and little bit very, uh, I can say mentally exhausting for us. But with the process, we can rely upon it. Okay,
That literally requires a hard work, right?
so
Is
much.
not easy, not at all.
No,
Just three
easy.
to four hours of sleep, and during exams,
Yeah,
I think this is
no,
also
no.
not.
4 hours of sleep is luxury in exam. 4 hours of sleep. The one who sleeps 4 hours, it means he has done everything. Everything. He has studied throughout the year. Even this is myth कि the one who studies throughout the year will sleep 4 or 5 hours aram se in the exam. No, no, no. The mental pressure is that much. MBBS university examinations. Now it's over. Sleep gone.
Nice, nice. So, let us come towards the next question. What's the biggest misconception people have about medical students?
Yeah, the biggest misconception that everyone has, whether it be towards a medico, whether it be towards a, well-fined doctor, is that they people are very heartless and they are very rude. Coming on to heartless, we are not at all heartless. Through the process, when we are undergraduate, when we are medico, when we are intern, when we are postgraduate, and when we are a, well-formed consultants, we have to go through a certain process that a common public can't judge what is going inside us, looking towards this, looking towards our facial expressions. What happens is, we will understand the pain of a attendant standing outside the ICU, standing outside a ward, or standing outside the operation complex, waiting for the doctor to come out and to, you know, uh, tell them about the condition of the one who is admitted inside, their loved ones who is, struggling between life and death, or is in a certain vegetative or a critical state. We know that very well. If we wouldn't have been aware about that, pain and that pressure, we wouldn't have been there in the wards, rubbing our legs off, standing the day throughout, taking rounds again and again, checking the vitals and taking histories of the patient pre-op and the post-op. We do this much because we are aware how this situation feels like. We are very well aware about the importance of life. We are very well aware about the importance of human resource. Coming towards rude comment, so what happens is, the people of my age, we are just out of schooling. We have lots of friend circle back in our hometowns, but when we enter this fields, we have been burdenized with so much of syllabus which we have to complete in certain amount of time, certain restricted amount of time. Talking about first year only, because this major things happen in first year only. Everyone calls you rude, हाँ भाई बड़े आदमी हो गए हो, कॉल क्यों उठाओगे, MBBS क्या मिल गई, एटीट्यूड आ गया तुम्हारे में. No, that is not attitude. Just live a day in our life. First year MBBS student has three subjects: anatomy, physiology, biochemistry. Anatomy subject, BD Sorasia's very famous book. It has 5 volumes: lower limb, upper limb, head and neck, abdomen, and neuroanatomy. Physiology has two volume part 1, part 2, and biochemistry has never ending cycles, glycolysis, glycogenolysis, lipolysis, and the names which are very tough to be remembered by the general common people. We have to learn them and we have to remain the full process. Just a period of 365 days. That too, we have term exams in between, we have pre-university exams in between, we have university exams in between. Loads of practical, pricking our fingers, इतना खून जीवन में नहीं निकलता है जितना फर्स्ट ईयर स्टूडेंट अपना निकालता है. Every HMAT practical he has to attain on himself, whether it be blood grouping, whether it be normal sugar testing, whether it be thyroid, KFT, LFT, TFT, and numerous amount of tests. For treating you people, we have to give our blood, and sweat, amount of sweat is unimaginable. So farmers and MBBS student are same. खून पसीना एक करके ही हम कुछ बनते हैं. खून फर्स्ट ईयर में एक हो जाता है, पसीना थ्रू आउट द टाइम एक हो ही रहा है. So we people are not at all rude. It's just we don't get that ample of time to pick your call, to talk, to conversate. But every person is an old habit now, that if I call XYZ, he'll pick up my call, he'll chit chat for hours and hours. But we know we have a planned schedule. If we chit chat for hours and hours, everything will be gone out of our hands. Then the professor will be chit chatting in the cabin with us hours and hours during the Viva time, insulting us.
Oh, that's so hard, literally so hard. Okay, just one follow-up question I want to ask. Is there any times that hospital haunt you, like for general people like us, we are so much like scared of going to hospital. So how you all guys spend your whole day, even after whole your 20-30 years in that hospital only?
Yes, I have gone through people who ask me, do you have any experience with the hospital haunts you or during your night shifts, etc. But the hospital, the medical care center is my workplace. Nothing haunts me because I have done practicals in first year where we have to dissect a dead human body. In India, coming from a Brahmin family, that to a Orthodox Brahmin family, going towards dead body in the common household of a typical Brahmin person has to be a ritual, because after that we have to take bath again and again. We have to purify ourselves before entering our own home. But with the process, because it was my profession, the first fear of being around dead bodies gone out of myself in first year. Nextly, I have seen people dying in front of my eyes. That was not at all scary for me. That was, internally cheering for me, because I can see the doctors doing their way best to save that one patient who was in the last stage of the disease. But that too, he left. It was cheering. It was not, scaring for me. And the hospital, it is my workplace. I have explored each and every corner of my hospital, and till the date, nothing scares me. Nothing scares me. The only thing that scares me is uh, sitting quiet in Viva examinations and saying sorry. So this is the only thing which scares me. Haunting experience is common for general people when they go to the hospital. Obviously, hospital is a place to be scared of. It's not amusement park. You have to be scared that, what, in the pedia department, I have seen some good postgraduate students or consultants scaring the shit out of children, that if you'll visit us next time, we'll put injections on your hand and everything. This is what they do to keep the children away from the hospital, and this is what they do to scare them, in order so that they follow a certain lifestyle and they don't do which is rendering them towards the disease. So hospital is not at all congruent for me, equals to scary. No, 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 nothing.
That's great. Obviously, if you just get scared of hospital, how can you work over there? Nice.
Exactly.
Okay, so that's an important question. Like nowadays, many people prefer discussing their symptoms and healthcare concerns with AI tools before consulting a doctor. Why do you think it is happening? And yes, what could be the impact of this on health of people?
Oh my God, this is sort of Gen Z things. Okay, in spite of the fact I am also Gen Z, but this is a common problem which every medical practitioner is facing these days. Some overly educated people coming us with the full list of signs and symptoms. Doctor, we are suffering from lenangiocarcinoma. Oh my God. So sometimes we feel that these kind of people God have designed to just cross check our knowledge. One of my very close senior, he told me he's in respiratory medicine. He has done PG from a well recognized government college. So he told me that once there was this lady, and she was very young, around 26 to 25 years of age. So she came to the OPD and she started explaining everything to the doctor in a medical, well recognized medical language, whether we expect the patient to explain us actually what they're feeling in their own comfortable language so that we can, process what is going on inside them. So she said, doctor, I am having irritation in my lower diaphragmatic area. What is lower diaphragmatic area? I've never heard about this. And when I evaluated my signs and symptoms, I just came to know that I am having severe emphysema. What? At that moment, the PG doctor felt like, oh my God, this lady is some, extraordinary surgeon or some well recognized doctor or HOD of some respiratory medicine. But when he evaluated her, it was complete bleak knowledge which she obtained from ChatGPT. So, what patients do is before coming to a doctor, a real doctor, they try to be their own assisted medical practitioner. The severest form of disease, like whether it be any kind of carcinoma or any kind of other malignancy, and they just came up with a result, and now they're dead scared. Now they have to visit a real doctor. Now they go to the doctor not for diagnosis, just to cross verify that whatever we have self diagnosed, whether it is correct or not. If it is correct, just give us medicine, our work is done. And if it is not correct, so just correct it yourself. This is your headache now. So it is, very dangerous sometimes also, because some very intelligent people, they take, if they even take medications on their own. And in India, everything is possible. Every kind of medication, whether it is on doctor's prescription only, is being given to some local pharmaceutical store without even the prescription of a doctor. So then they'll end up in emergency. Now they have to visit a real doctor. So these kind of cases are very interesting, and I just request all of you, please don't do this. We people are here rubbing ourselves off, reading every possible subject that we can, from ENT to the surgery. So you don't need to visit us. Even we practice on our own. If God gave the general people the power to have a surgeon's hand, I bet you those people can even suture themselves. So it's interesting, but it's scary also.
Okay, so we must go to doctor, right? So
Yeah, you must.
okay, so can you please draw a line between using AI guidance and seeking professional help? Like it is really important. Just like if we just having a simple headache, obviously no one will prefer to just go to doctor, obviously. So can you please draw a line between them?
Apart from common diagnosis, just a clear-cut question: would a AI be able to suture you? Would a AI be able to apply stitches on you if you end up being in a road traffic accident, bleeding yourself off? We people are here, Baba. We have been put in certain process that we have to do multiple things. We have to not only just learn about a subject, we have to practice it again and again. Even me, I am, you know, I've cleared first year, second year, and have been at a certain level that I can apply suture very well. But with every coming in advancement to the technology, with every coming in, newer technologies, we have to practice it. Would a AI be sitting in his home doing practice of the suture on a silicon pad? No, it won't be. This is us. This is we, the medical professionals who are trained to do so. This is just this is where the conversation ends. Would our AI be able to save you if you were there in the ICU struggling between life and death? No, it will be responsible for you being there, because it will diagnose you wrong. It will give medications wrong. Even if the doctor's job is the only job in the world AI can't take over. Even if you build, the smartest and smartest test software. It wouldn't be able to treat you. It wouldn't be able to operate you. Even when the automatic laparotomy surgeries are done, the doctor, the man, the that medical professional is the one who is handling the AI. It is not doing anything on its own. So it is the biggest misconception which need to be clear. And this is the one question which answers it. And this is where the conversation ends. Medical professional is a medical professional, and AI will always be a AI and a robot which is under our influence, which we control.
Okay, so just we must shut our AI down and go to doctor if we have any kind of problem. That is the
Yeah.
conclusion, right?
Yes.
Okay, right. So I would like to thank you a lot for just taking that much time from your schedule, obviously a busy one, and come here to just tell us something about all these things which are in the mind of general public. Thank you so much, Sarthak.
Oh, no. Thank you to you too. It was such a pleasure sharing my experience. It was such a pleasure. And if it benefits someone, it is more pleasure for me.
Okay, thank you so much.
Okay, bye. Take care.